Got a lot of women out here to hear about an important topic about women and heart disease tonight. Before Dr. Chaudhry gets going with his excellent presentation, I'd like to share a couple things with you about these educational events. And first off, these events are part of living out the cardiovascular team's mission here at Unity Point Health Trinity, to take care of the hearts of our community so that the people live happier and healthier lives. So these educational events are just one of many things that we offer throughout the community. And next month, we'll be in Muscatine. So if you want to go up to Muscatine, go there, or if you have friends there, please invite them to come out, because on March 8th, we're going to be talking about exercise and heart health. And we'll be talking about the many benefits for your heart. And then the cardiac staff there in Muscatine is going to lead the group through some exercises. So it's going to be a lot of fun. It's going to be a hands-on educational event. So that'll be taking place there in Muscatine. And then in April, we'll be back here in the Jardine. So the educational events, these monthly events, are just part of us living out our mission. As you know, there are other ways. So we also have some hands-on opportunities there with the culinary nutrition classes that I just hate leading. So show of hands, how many in the room have come to one or series at least? Okay, we've got a lot of handfuls. So if you haven't done it, talk to these people. So did you fall asleep during the presentation? No. Okay. Did you taste blah food? No. No. Okay. So this is about having fun and learning how to make delicious food that also is good for your heart. So we have an April coming up, Cooking with Heart for Diabetes. Then in May, we'll have a foundational one and also cancer. So those you can get more information on our website about those, and you have in your packet tonight some information. So also, if you want to get hold of us, these are the different ways to get hold of us. You can get hold of us through email, through phone, or the website there. So we have a heart newsletter. So if you're not on our heart newsletter, then contact us, because we do that once a month with valuable information about your heart. And we also let you know about the ongoing events. Now tonight for the treat, you had trail mix. It's my favorite trail mix. I've been making it for years. So what ingredients were in the trail mix tonight?
Oh, dried cranberries.
Dried cranberries. Sunflower seeds. Pumpkin seeds, I think I heard. Almonds. Chocolate. Okay, that had to be because Dr. Chaudhry, he loves chocolate. So yeah, that chocolate in there.
Dark chocolate.
Dark chocolate, it is. And it's a really good, I think it's a really good combination. Everything, there's nuts in there and the dried cranberries and then the seeds there. And I did try and get unsalted, unroasted ones there, and I think it this really makes a nice little treat there. So okay, so on with the presentation, I want to introduce first Dr. Chaudhry. He is a cardiac surgeon. He's board certified in adult cardiovascular surgery. He went to medical school at the Chicago Medical School. His residency was at Loyola University Medical Center. He did fellowships and internships at Brown University Rhode Island Hospital. His specialties include open heart surgery, vascular surgery, thoracic surgery. And he practices, we are blessed to have him locally here at Trinity, Rock Island. He's been here with us for 14 years, and we're very thankful for that. Please help me welcome Dr. Chaudhry.
So I have a lot of, can everyone see this, or do you want us to turn some of the lights off? In the back, it's not too bright. So I've got a lot of slides. There's a lot of information here. And quite frankly, I could spend an hour, actually a day on each individual slide. So I'm going to blow through things because this is just an overview of things. And a lot of this is, I hope by now, common sense for the general medical community. How many times does the average human heart beat in a lifetime? Anyone know? A million times? 2 million? 100 million? 3 billion? 4 trillion? Average human.
3
billion.
3 billion.
3 billion. That's a lot. Anyone else?
A lifetime. That's a lot.
4 trillion, so the answer is 3 billion. So talk about impossible body standards. The reality is that it's not that hard. Little joke. Meaning taking care of your heart is not that hard. Just little steps is all you have to do. So why do women live longer than men? Shopping never causes heart attacks, but paying the bill, obviously it's changed now because women do suffer heart attacks and women do pay the bills. Who's this? Why did I put her up here? She died of heart failure. Who's this? Well, it says Lou. Why did I put her up? She had aortic aneurysm. She had a Bentall, so aortic aneurysm surgery. She died in the recovery waiting for another vascular surgery.
Yeah.
Where are these two people? Barbara Bush and Barbara Walters. What do they have in common? They both had aortic stenosis and they both had successful aortic valve surgery. And where are these two people?
Lisa Marie.
And they both died actually of heart disease. And where are these two? And what do they have in common? So they both were asymptomatic, had no symptoms, but actually turned out they had critical coronary disease, had stents, would have had big heart attacks if they didn't have an astute clinician on them. You do not want to be here, right? You do not want to be here. Little Joe cardiac arrest, right? Because this is what happens. Carrie Fisher, she had a cardiac arrest. She died recently. Point being that cardiovascular disease has been the leading cause of death in the USA since 1918, with the exception of the pandemic, the flu pandemic. I'm not going to include the COVID pandemic. Half of all cardiac deaths are actually from coronary artery disease, blocked arteries. So almost 3,000 Americans die every year, every day, one every 30 seconds. And it's not just older people, younger people are dying. So 150,000 people under the age of 65 die every year from heart disease. And actually, heart disease claims more. What's just happened here? Claims more lives than all other cancers combined. So heart attack, about 1 million and change heart attacks a year, of which almost a half are fatal. And half of those deaths occur within 1 hour of a symptom, meaning before the person even gets to the hospital. That's why the prevention and diagnosis is extremely important. So women in cardiovascular disease. So actually, cardiovascular disease kills more women than all cancers combined. And in fact, among females aged 20 and older in the US of A, 45% of women over 20 are actually living with cardiovascular disease. 51.9, so a little bit more than a half, meaning more women than men die from high blood pressure related deaths. I didn't know this, that more women than men die of strokes. So there's 4 million women in America who've had strokes, and of all deaths, 57% of deaths from stroke are actually from women. In women. So 500,000 women die from cardiovascular disease, of which about 200,000 is from coronary disease every year. More women than men die of stroke. There's about 40 million women in America who have cardiovascular disease who are living with it. And these are just some, just to sort of complete the picture. So pregnancy, men don't get pregnant. 50% of women enter pregnancy with good heart health, meaning half don't have good heart health. Cardiovascular disease is the #1 killer of new moms, accounting for 1/3 of maternal deaths, even in the United States. Up to 20% of women will have health issues during pregnancy, including hypertension, preeclampsia, and gestational diabetes. So if someone has had this during pregnancy, they are at an increased risk for cardiovascular disease later on in life, and therefore you have to be extra cautious in terms of your own lifestyle management. Women, this is an interesting thing. This is from the American Heart Association. women are less likely to receive CPR. Someone's on the ground, women get CPR less than men, and this is their opinion of why it is, because of fear of accusations of inappropriate touching. But the point is, women don't get CPR as much as men do. Since 1984, more women have died from cardiovascular disease than men have in the United States. Women are more likely to die of a heart attack. So 2 people have a heart attack, man or woman. Woman is more likely to die than a man. And unfortunately, this is true also. Women are less likely to survive after bypass surgery, after open heart surgery. And we're not sure why this is, partly because there's a lot of literature, a lot of research that has actually looked at men and assumed that everything is the same for women, and in fact, it's probably not. But so there's also false assumption that women are less likely to have heart disease. You know now that's not true. Women are less likely to get diagnostic testing. And in fact, women are less likely, even when they've had a heart attack, they're less likely to be put on medications that they should be on. Aspirin, beta blockers, and ACE inhibitors. Not here in the Quad Cities, not at Unity Point, but in the United States of America. So I've sort of talked about all of this here. So 64% of women who die suddenly of coronary disease actually have had no previous symptoms. And 90% of women have at least one risk factor for heart disease. In terms of symptoms, the classical that everyone's heard about, at least for men, is sweating, chest pain, radiating down the arm, shortness of breath, heart burning, indigestion. Women do have those, but they're more likely also to have the other stuff, which is shortness of breath, discomfort between the shoulder blades, dizziness, indigestion, fatigue, and sleep disturbances. Again, I've talked about many of these things, and I'm not sure that there's really nothing else that's new. Menopause and heart health. It's not that menopause itself increases heart disease, but it's all the stuff that's occurring around that increases heart disease. So a couple of interesting things. If someone has gone into menopause before the age of 45, they're actually at a higher risk for heart disease. If someone has had their ovaries surgically removed, they're at a higher risk for heart disease. And I mention that because if someone has that, then they have to be even more cautious about their lifestyle, etc. Estrogen, after menopause, estrogen drops. Estrogen inhibits the clogging bar. This is very simplified. That's the sort of concept behind this. And I think we talked about all of this. A few more things. Gestational polycystic ovarian syndrome, other systemic inflammatory processes. But there's a lot of other stuff that we really don't talk about. That's psychosocial risk factors, abuse, socioeconomic deprivation, poor health literacy, and other environmental risk factors. They all increase the risk for cardiovascular disease in women. So what is cardiovascular disease? It refers to diseases involving the heart and blood vessels. So in the heart, it leads to angina, chest pain, heart attack, heart failure, and arrhythmias. In the brain, it causes strokes, mini strokes. And in the peripheral vasculature, meaning the legs, the arms, it leads to claudication, which is pain because there's a lack of blood flow getting to the legs or feet, as an example, ulcerations, and ultimately amputations. The common thread is that there's a problem in the circulatory system in the arteries, so in the brain, in the heart, and could be the kidneys and the legs. And it's a susceptibility to atherosclerosis. This is the key. It's an inflammatory process. There's a blood. So this is an angiogram looking at the carotid arteries going to the brain. And you see this is a normal angiogram. So this is someone who has a blockage in the carotid artery, and this is what can lead to a stroke. I don't know if it shows up well back there. This is a angiogram of the heart artery. And you can see right there, you can see there's almost no blood getting across. If that closes, that's a big heart attack. So again, the concept being there's an issue in the arteries feeding any organ. If it closes, it's a heart attack. In the heart, in the brain, it's a stroke. And in the legs, it's a vascular disease. So this is an autopsy of someone's coronary artery. So the artery lumen should be open like this. This is where blood's going through, where in fact all of this should be open. So this is just junk, cholesterol, plaque, etc. So in the heart, so your heart arteries, even though your heart is filled with blood, the blood in the heart doesn't do anything for the heart itself. Heart muscle needs its own separate blood supply, and that's in the form of arteries which come down the arteries here. So blood is coming down here, right here, you blow it up, you see there's a blockage here, and that's what causes heart attacks, with the clots and spasms. And the lag causes this lack of blood flow, not healing, and this is what leads to amputation. So this is something that takes decades. This is something that we need to teach our kids, and even when we're young and in middle age and older, it takes decades to get to this point. They've actually done autopsies in kids who unfortunately had a car accident at the age of 15 and died. And even at that age, in seemingly healthy kids, there's already the beginning of some fatty streaks, if you may, in the arteries. So this is something which is a long-term issue. First, third, and fourth. So really the 30s and 40s is where it starts to take off. So the evolution of cardiovascular disease, a little bit simplified, but the concept is that we have a normal kid who becomes an overweight, inactive kid, who becomes an overweight, inactive adult, becomes a sick adult, and that adult suffers and then, dies young. And there's a lot of reasons for this. There's technology, junk food, tobacco, too much food. Believe it or not, we have too much food in this country, at least too much unhealthy food, and knowledge deficits. This is the purpose of a meeting like this, is to help address that. And then we do a crazy amount of stuff here. Surgeries and baths and transplants and drugs, but this would be a lot easier if this was addressed, much, much earlier in life. So framing out heart strategy, I'm going to talk about this. And someone who's not had any thrombosis, stroke, heart attack at the age of 60, they're going to live a lot longer than someone who's had a heart attack. So someone who's had a heart attack is going to live 9 years less at the age of 60 than someone who's not had any heart issues, and actually stroke's even worse, they're going to live 12 years less. So cardiovascular disease, an individual's risk for future events is actually modifiable. Genetics plays a role, but there's a huge role in what we do to ourselves. And so lifestyle changes are very important: tobacco cessation, healthy diet, exercise. And then there's a lot of medications that we can prescribe if lifestyle doesn't work: blood pressure medications, cholesterol medications, etc. And so predicting the risk of an individual patient and for yourself is very important, because it gives you a sense of what your risk is and how aggressive you have to be in terms of helping to prevent this. And there are many risk models to predict cardiovascular disease. The main one, though, is the Framingham risk score. And I'm going to spend a little bit of time on this because this is where we get most of the information that we know today about heart disease. So this is from Framingham, Massachusetts. It's a long-term study in which they looked at demographic, biological, psychological risk factors in heart disease. Began in 1948, give or take 5,000 people between the age of 30 and 62, followed up with their kids. So the next generation, 71, third generation in 2002. And they looked at everything. They actually did blood samples and EKGs and histories and x-rays, etc. And so 75% of the original people actually died or are dead, and they all died of heart disease. And prior to this, very little was known about arteriosclerotic cardiovascular disease. And so much of what we know today is because of the study. So in the 1960s, from this study, we first realized that cigarette smoking increases the risk for heart disease. So we've known since the 1960s that smoking is bad for you, yet there's a ton of people who still smoke. And I don't buy the argument that it's an lack of education. Everyone has known in our generation that smoking is not good for you. In the 1960s, we knew that increased cholesterol and blood pressure increases the risk of heart disease, and that exercise decreases the risk of heart disease, and obesity increases the risk of heart disease. 1970s, hypertension and the association with stroke, the fact that postmenopausal women have a higher risk for heart disease, and also we started looking at psychosocial factors affecting heart disease. In the 1980s, we realized that HDL actually is a good thing. And just some more findings of the study. So the major findings: pre-hypertension increases the risk of heart disease. This is from the 2000s. Obesity, the risk for heart failure, and I'll forget the other stuff. So can we, people in the back, can you see this? Can someone turn the light
Yeah.
off just for 2 minutes?
Thank you.
And so this is a risk score, and I want everyone to do this for themselves. So basically, you look at how many points you have, and it will tell you what your risk is of having a cardiovascular event in the next 10 years. So if you are 60 years old, you get 8 points. And let's say your cholesterol is 200, you get 1 point, that's 9. Let's say your HDL is 35, that's 2 points, that's 11. Let's say your blood pressure is a little bit high, that's 13. You're a diabetic, that's 20. And let's say you don't smoke. So 20, that means you're way over here. You've got more than a 27% risk for having a cardiovascular event in the next 10 years. I think we have this on the Trinity. I think we have this because I've given this similar talk before, and we will find this risk score that we actually have. I think everyone should know what the risk is. Yeah.
At the end, could you do that on the screen?
Sure, yeah.
So we could, yeah, that'd be great. Take a picture of it.
So some of this stuff may be repetitive, but I really want to hit this home. Risk factors for cardiovascular disease, things you cannot control. But there's a whole bunch of stuff that you can. You can't control your age. You can't control your gender. Testosterone actually elevates LDL. Estrogen actually neutralizes free radicals. And if you have a male relative less than 55, first degree, mom, dad, brother, sisters, kids, or first degree female relative less than 65, that's a risk factor for cardiovascular disease, but you can't control that, right? You can control everything here.
I get the medical center personnel. Rapid response team, room 454. Rapid response team, room 454. Rapid response team, room 454.
So we're going to go through some of the risk factors in a little bit more detail. So cholesterol is not all bad. There's actually 2 sources for it. It's either from the food or it's made in your body. And so there's an LDL. Again, this is a little simplified, but just to hammer the point home, LDL is sort of the bad cholesterol, increases the risk of heart disease. It's a major component of plaque that clogs arteries. LDL is the good cholesterol. Women actually tend to have a higher HDL than men do. It increases with exercise. That's one benefit of exercising. It actually helps carry some of the bad cholesterol out of the arteries. So having a high HDL above 60, and I'm going to hit this home, you have to know your numbers. There's no excuse not for knowing your numbers. What your LDL profile is, what your blood pressure is, what your hemoglobin A1C is, etc. So a high level of HDL actually is good and actually can negate one other risk factor. Meaning, what that means is if you have high blood pressure, well, having a very high HDL actually helps compensate for that. Obesity, so it's defined as a BMI over 25. So this is the take home point for women. On average, women with a waist abdominal circumference of over 25 inches is an independent risk factor for heart disease, increases your risk for heart disease. And there's many reasons why we think that's the case. It increases insulin resistance, affects cholesterol metabolism, increases blood pressure, and it creates sort of an inflammatory state in the body. Coronary artery disease is sort of an inflammatory process. And so obese people have 2 to 6 times the risk of developing heart disease. A normal waist to hip ratio should be for women less than 0.85. I'm sorry, I'm not sure what's going on here. Less than 0.85. And basically you use the way you measure it, just beneath your ribs, that number divided by the widest portion of your hips, divide them, should be less than 0.85. Men tend to have this apple. Women tend to have this pear shape. This is actually worse. This is associated with visceral fat. So this is a worse. This is actually better profile. So obesity and the risk of heart disease. So for every 10 years that a person is obese, the risk of heart disease goes up by 25%. So for if it's 20 years, then it's 1.25 times 1.25. So it's a lot higher. Physical inactivity. So being inactive in and of itself is actually a risk factor for heart disease. And it's actually at the same level as either smoking, high cholesterol, high blood pressure. Is that clear? Being inactive is a risk factor for heart disease. So physically, every morning my brain tells me to exercise. And my body laughs at the idea of, well, you gotta put in the time, the energy, effort. Diabetes is a big risk factor for heart disease. So at any given cholesterol, there's 2 to 3 times higher risk of a heart attack. I'm sorry, I'm not sure what's going on here. There's a 2 to 3 times higher risk for a heart attack or a stroke in a diabetic versus a non-diabetic. People who are diabetic, so you have 2 people, you have a diabetic and a non-diabetic, both have a heart attack. Diabetic is more likely to die from the heart attack than the non-diabetics. 80% of diabetics actually ultimately die from heart disease. And the risk of sudden death from a heart attack for a diabetic is the same as someone who's already had a heart attack. Once you've had a heart attack, your risk for a heart attack, a subsequent heart attack is higher. Smoking increases the risk for heart attack 2 to 3-fold, stroke even more. Even smoking 1 to 9 cigarettes a day. People, I'll ask, do you smoke? No, not really. Well, I only smoke 5 cigarettes a day. Well, 5 cigarettes increases the risk of heart attack by 50%. Smoking actually reduces the good cholesterol and increases the bad cholesterol, causes injury to the blood vessels. And actually, I didn't know this, it decreases estrogens and increases androgens, which are somewhat protective and somewhat destructive for the cardiovascular system. So, in cigarette smokes, you actually find butane, which is in lighter fluid. You find ammonia, which is in cleaning products. Methanol, formaldehyde. Well, we did this in medical school when we, did autopsies on cadavers. Well, they're in formaldehyde. Radon, cyanide, they use this in death row. Arsenic and acetone. One is cigarette smoking is bad news. Unfortunately, since 1965, a lesser percentage of men are smoking compared to women, meaning the incidence of smoking has decreased more in men than it has in women. So equality in smoking and disease, there's about 20 million women and girls in the United States who are smoking. This is the one easiest thing to do. Quit smoking, you'll actually probably live longer. So sleep and cardiovascular disease. So there's some data to show that if you sleep too much or too little, it's actually not good for your heart. So if you sleep consistently less than 5 hours, you have double the risk of heart disease. If you sleep too much, like my kids, they're very young, but more than 9 years of age, you have a 50% higher risk for heart disease. We don't talk about this, but there's a lot of psychosocial factors that go into the development of cardiovascular disease. So having a poor social network, living alone, anxiety, depression, stress, all this stuff is bad for your heart. So my doctor told me to avoid any unnecessary stress, so I didn't open this pill. That's not what I mean by stress. And there's many mechanisms with which stress causes heart disease, but essentially it's an inflammatory process. It inhibits the inflammatory process in your body. So please, heart, stop getting involved in everything. Your job is to pump blood and that's it. We worry about a lot of stuff in life we have no control over. Some of the stuff is natural. You worry about your kids, but there comes a point that you can't let it overcome you. A little bit of stress is good. A little bit of stress keeps you on your toes, but too much stress wreaks havoc in your body. And it does this by many different mechanisms. So stress, in some people, leads them to smoke. In some people, causes them to have a lack of sleep, which is bad for the heart. It can lead people to a poor diet, diabetes, high blood pressure, et cetera, and ultimately lead to heart disease. So managing stress is very important in managing heart disease. This is actually a very interesting concept, forgiveness in cardiovascular disease. So people with a revengeful personality have a higher risk for early death from cardiovascular disease. So when you forgive someone, you don't forgive them for them, you forgive them for yourself. I really believe in this, actually. And a little bit in that, so type A personalities are physiologically different. Type A doesn't mean someone who works hard. Type A means a person who is hyper responsive to any given event. So type A's actually have more rapid blood clotting. They have higher cholesterol and triglyceride levels under stress. They have a greater autonomic arousal, elevated heart rate, and blood pressure in the face of challenging events. They're sort of combat hyper-reactive. Don't be type A. Alcohol, small amounts okay, large amounts not good. So really, it's an interaction of different factors. And there's no clear-cut line, meaning it's not that if your blood pressure is this, then you're going to get heart disease. It's a mix of all of these. The reality is that the majority of events occur in people who only have modest elevations of multiple risk factors. It's not that you have crazy elevation and all the modest elevation and a bunch of them can cause this. So don't wait for a heart attack to take action. Take action now. Everyone should know their numbers. Your total cholesterol should be less than 200. LDL less than 100. Actually, if you've had a heart attack, should be even less than that, less than even 70. And your HDL should be 60 or higher. So you need to know your numbers. You need to get tested, and you need to act on it. So even a 10% reduction of your blood cholesterol will reduce cardiovascular deaths by 20 to 30%. All adults above the age of 20 should get tested, and every 5 years thereafter, if it's normal, obviously more often if there's an issue. Blood pressure should be checked at least twice a year for people who don't have high blood pressure. It is known as the silent killer. And if it's high, you first do what you can. Diet, weight loss, exercise, health prediction. If it doesn't work, then you've got to go on meds. Blood pressure takes a lot of lives. My God, your hypertension is out of control. Well, that's because, Doc, you told me to take every report of a medical breakthrough with a pinch of salt. It's another medical breakthrough. The point of this is that get your information from valid sources. That really should be your doctor. Don't just get it off the internet. I mean, they're obviously very good internet sources, but get it from a valid source. In terms of dietary considerations, eat a lot of colored fruits and vegetables. Limit foods, which are high in calories and low in nutrition. Eat junk food, grain products, eat them. Have non-fat or low-fat products. Use less fat meats with chicken, white meat, fish, lean cuts. Limit your saturated fats, your trans fats. Eat less than 6 grams of salt a day, and have less than 2 drinks a day. Has anyone been here? No. This is in Vegas, and this is also in Phoenix. So I actually went there. There's a line to go in. So I actually went in and said, "Hey, I'm a heart surgeon. I just want to." So they actually let me in, and they actually said, "I'm not getting that. Dinner would be for free for me." And I said, "No, it's okay." It's actually, where the most people have been to Vegas, right? It's the old Vegas where there's the the light show above. It's actually right in that area. Fremont Street. So they actually have a double bypass burger, a triple bypass burger, a big burger.
Except for 1%.
It is. It did look disgusting. If you weigh more, they actually have a scale up front. If you weigh more than 350 pounds, your dinner is free as well.
Oh.
Eat this, not the double bypass burger. In terms of fat, again, less than 30%, saturated fats less than 10%. Dark chocolate does raise HDL, it does improve insulin sensitivity a little bit, does decrease blood pressure a little bit, does improve blood vessel reactivity. A little bit of dark chocolate's not bad. That's my excuse for having it. So alcohol, if you look at the relative risk of cardiovascular disease. So this is 1, and this is lower, and this is higher. So it actually decreases down to about a drink or 2 a day, but then it increases. Point is, in moderation, it's okay. Green tea is actually some literature to say that actually help a little bit. Olive oil increases HDL. It does decrease your total cholesterol, your HDL, etc. The concept is to eat this and less of this. Unfortunately, a lot of Americans eat more of this and less of this. Because otherwise, this is what happens. The lion's all about me. The lion dies at the age of 25. This has to be Photoshopped, though, right? I mean, I can't imagine. I wouldn't be smart. So next thing you can do is quit smoking. So the risk of a heart attack actually decreases within 24 hours of quitting smoking. The risk of a heart attack decreases. And a year after quitting, your risk of a heart attack decreases by 50%. And in 15 years, your risk of a heart attack is as if you've never smoked before. It's never too late. I'm prescribing a patch to help you quit smoking. Wear it over your mouth. There are so many excuses, and I can tell you, I understand it's not. I've never smoked, and I've seen people destroy their lives because of smoking, meaning they've had amputations, etc. So I understand it's obviously not easy, but you gotta quit. And ultimately, I think you need to have it up here. You need to decide on the job. Exercise is very important. So preventing heart disease, maintaining a level of physical activity that keeps you fit and matches your caloric needs. It actually serves several functions. It reduces the incidence of obesity, increases your HDL, decreases the LDL, and actually helps control diabetes and hypertension. And you'll fit into your, I actually have to really suck my gut in to get my, into these pants. I need to, do this too. So the benefits of physical activity are many. Lowers the heart rate at rest and during physical activity. That's good for your heart. Decreases the risk for arrhythmia, decreases blood pressure, actually improves coronary circulation, and so on and so forth. So exercise is important. So they've studied this, and mortality is halved in retirees who walk more than 2 miles a day. So if you're retired, you walk more than 2 miles a day on average, your risk for a heart attack will be quite a bit less. Someone who is inactive has at greater risk of having heart disease as someone who has high blood pressure, high cholesterol. Meaning physical inactivity is a risk factor for heart disease. Exercise decreases the risk for diabetes and stroke. And with regular exercise, you can actually decrease your blood pressure by 20 points. I'm not an exercise specialist. This is from the AHA. These are just some guidelines. You can, look them, pull them up yourself. One is get out and exercise. And you don't need anything complicated. All you need is a pair of runners and walk. Moderate to physical, and so what fits your busy schedule better? Exercising 1 hour a day or being dead 24 hours. So there are many benefits of exercise and tobacco and physical, all this. I mean, quitting smoking actually decreases the risk for cardiovascular stuff, cancers, chronic respiratory illnesses, etc. So the point is, everything that you do to help prevent heart disease has multiple other benefits as well. This is the diagnosis. Signs and symptoms. Some people have no symptoms. Some people have chest pain, shortness of breath. A heart attack is actually when a heart muscle is completely blocked because there's an artery which is totally closed. And there's also sudden death. You know, and we talked about this as well, so I'm not going to belabor the fact. So there's the screening and diagnosis. I'm talking about coronary artery disease. An EKG measures electrical impulses. A stress test actually sort of measures blood supply to the heart. An angiogram is the gold standard in terms of definitively knowing if you have a blocked artery or not. If someone has significant blockages, and now you're going to do all your lifestyle stuff, but if you have a 95% blockage in a critical artery having symptoms, no medication is going to undo that 95. Let's say it's a widowmaker. And so there are many treatment options for that: aspirin, blood pressure medications, cholesterol medications. And then there's stenting, and then there's heart surgery, and obviously cardiac rehab is involved in that. So this is an angiogram of a artery. So this is a artery in the surface of the heart, and you see there's a plaque here. So the blood in this portion is not getting enough blood. And so what cardiologists will do, there's in here, there's a blocked artery, there's plaque in there. They'll put a balloon and they'll leave a stent behind, push the blockage to the side, and stent behind, get more blood to your side. Heart surgery. Hasn't changed in the last 60 years, actually. The concept is exactly the same. We do heart surgery when you have left main disease, the main artery has a blockage, or when you have multi-vessel, many of the arteries have blockages. Another indication is when you have valve disease, you have either too tight or too leaky a valve, or aneurysmal disease. And I just want to go into history a little bit, because these folks, in my mind, are rock stars, the people who did heart surgery and cardiology many, many years ago. Theodor Billroth was the biggest of the big boys back in the 1800s in terms of medicine in the world. He's a Viennese surgeon, and he said, "Let no man who hopes to retain the respect of his medical brethren dare to operate on a human heart. The heart is the impenetrable temple of life, a violation of which would result in certain cardiac death and fate." Well, thankfully, he was wrong. So bypass surgery is when you have a blockage here, you get a vein or an artery from another part of the body and just reroute blood. So, and many people ask, how do you do it? Basically, you sew it. And this seems like it's huge, but this may only be 2 millimeters in size. And so we sew one artery to another. And this is what it looks like. This is the heart. This is so the head is here, the foot is here, and this is the aorta. And so there's the lima, it's one of the bypasses. So blood is normally going like this. So in this patient, there's a blockage here. So you're just rerouting the blood, and that's why it's called bypass surgery. Typical heart surgery room, surgeon, assistant, scrub nurse, perfusionist, anesthesiologist, and sleeping behind. That was a joke. And we can't do surgery without anesthesia. These are wires. This is how we close the chest, and we just gotta zip them together like this. And I wanted to talk about, I was talking about the rock stars. He is the biggest of the biggest rock star. Walter Lillehei from University of Minnesota. He's called a king of hearts, not the folks in Texas, Baylor and Cooley, it's actually him. So back in the 1940s, kids would be born, and even today they're born with big holes in the heart. And in some kids, the holes are so big that if you don't fix them, everyone dies, right? You've got to fix them. In order to fix some of these big holes, you got to sew the hole together. Well, there's no heart-lung machine. You got to cut the heart open. You can't do it. This is what he did. He took the parents into the OR and the baby, and from the parents' groin arteries, so use the parents' heart and lungs as the heart-lung machine, parents' groin arteries, plastic tubes to the baby's carotid artery and vein, and actually did 48 kids. All these kids would have been dead. They all would have been dead. Did 48 kids, 44 survived, 42 to adulthood. Actually, at his 80th birthday, every kid who was alive, and I think it was like 36 of them, showed up to his 80th birthday. This is the Life magazine. This is the front page of Life magazine of the very first surgery, and this is exactly what was going on. Cross circulation from, this is actually a mother to child survived. And I only mentioned Gibbons. He's a guy who I would say was the initial investigators to create the heart-lung machine. So heart-lung machine, this is the heart. So when you open the heart, you can't just open the heart, right? You just die. And so you have to have it very controlled. You've got to stop the heart. And so what you do is you have a pump in which you get a tube which drains blood back from the heart, goes into this chamber. It does its magic, and then you pump blood back here. So the entire body is fed by the heart-lung machine. And I would say this is one of the biggest innovations in medicine in the last 100 years. I mean, obviously, you know, insulin and some other stuff as well. But 700,000 people have heart surgery a year. And it's amazing today compared to 1980. Today, an 82-year-old person who's got slightly weak lungs and slightly weak heart and a little kidney issue, a little that issue, has a lower risk of dying with elective heart surgery than a 50-year-old active, healthy person who needed one bypass in 1980. The point is the surgery's gotten much, much safer over the years. I thought this was very interesting. This is a Pledge of Allegiance. I'm sure there's an anthem, and everyone's got their hand on their heart, but he's got his hand on his stomach. I mean, they say the way of a man's heart is through his stomach. So vodka and ice damage your kidney, rum and ice damage your liver, whiskey and ice damage your heart. This is bad. Don't use ice anymore. Just a little bit of certain humor. We always do this, right? You've got to make sure you cut the right or left. So this leg, they cut it off, and when they take it out, it says not this leg. Fortunately, it's only one heart, so we don't have to worry about this. So I'm going to talk a little bit about aortic stenosis, which is a very common issue. So this is the valve, which is normally closed. Your heart squeezes the valve open. So with each heartbeat, the valve should do this. And in aortic stenosis, the valve doesn't open as well. It's like lifting weights. When you lift weights, your arms get bigger and thicker. This is your heart lifting weights. It's not good for your heart to lift weights. And if it's not dealt with, so this is a nice clean valve, opens widely, closed. And here you can see it's rigid, calcified, happens with age. And so this is what a normal valve looks like, nice and thin. This is a real life aortic stenosis valve. And so if this is not dealt with, people die real quick. So from the time that you develop a severely stenotic valve with symptoms, 50% of people have died within 2 years if you don't fix it. If you fix it, you live whatever you normally would have lived. Actually, this is worse than many cancers if you don't fix it, but this is like a cure if you fix it. So this is the old-fashioned way. I would say old-fashioned way. We still do this. In fact, I did this today. This is actual real-life surgery. Valve, you cut it out, you put a tissue valve in or a mechanical valve. But we have evolved. Do anyone know where this picture's from? MGH? Anyone know what MGH is? They arrogantly say man's greatest hospital, Mass General Hospital, Harvard's flagship hospital. So actually, this is in the ether room. And no kidding, this is the way they did surgery 300 years ago. Everyone grabbed a limb and they had at it. So we can do TAVR much better. You don't have to open the chest, aortic valve. You can actually go right through the groin and put a brand new valve. And we're doing that. We just did 500, I think, 500 just, I think a month ago. This is it. So this is what Lucille Ball had. This is what John Ritter sort of had this as well. This is the heart. This is the blood vessel, and you can see how it's ballooned out here compared to how big it is here. If this ruptures, this is instant death. There's nothing you can do with this. So you have to fix this, before that happens. This is what you cut it out, you sew a graft in between. This is in the back, a big, large aneurysm, huge surgery, but now you can just put a stent. Point is the thing that really, now I know why they call it ICU, and this is why you want to have a stent. Yeah. So in summary, the leading cause of death for women is cardiovascular disease. And the vast majority of cardiovascular ailments have a large preventable component. Quit smoking, eat a healthy diet, exercise, and have a healthy weight. And we have many options for treatment of diseases, medications, stents, surgery. And if you are someone is already diagnosed with heart disease, don't be disheartened. Science really has made a lot of progress. Monitor your risk factors more aggressively. So if you have a little bit of high blood pressure, a little high cholesterol, okay, you can't change what it is, but monitor it and address it. Eat healthy, do all the things that we talked about. This is a very interesting slide, and I agree with this. The concept that the leading cause of death is heart disease, cancer, or stroke, and in fact, really, we should say the leading cause of death is tobacco, poor diet, physical inactivity, alcohol consumption, that kind of stuff. So this is a guy, a boyfriend saying to his girlfriend, if my heart's broken, well, she's saying, look, your heart was really broken, you'd be dead, so shut up. The date night, you and me and a moderate amount of red wine and dark chocolate. And this is the one, being vengeful, right? Don't break anyone's heart. They only have one. Break their bones. They have 2 to 6. One is, this is really true. Be a nice person in life. Treat each other with respect. All right. Thanks very much, everyone.